So in this video, I'm going to show you the pros and cons of using a pacifier, as well as when is the right time to start, when is the right time to stop, and how you can help the baby come off it. Hi guys, welcome back, and today I want to talk about pacifiers. Should you use it? Is it necessary? And what should you know when it comes to using a pacifier? So you're home from the hospital and you're trying to just get used to the routine. You're taking care of the baby and the baby just wouldn't stop crying. So you try everything in the book that you know of, but nothing works. And as soon as you use the pacifier, it's like an automatic mute button. So there are some legitimate reasons why people are worried when it comes to using pacifiers. This is convenient from the parent's perspective, but am I creating an unnecessary habit for my baby? What happens if it interferes with the feeding? But rest assured to know that sucking is completely normal. In fact, about 75% of the babies in the Western world use the pacifiers at some point. So if it is okay to use the pacifier, when should you start using it? Well, that really depends on what your plan is for the baby when it comes to feeding. If the baby is feeding straight out of the bottle from the get-go, you can start the pacifier pretty much at any time. If you are breastfeeding, it is generally recommended that you don't use the pacifiers until the baby falls into that regular routine. And that usually takes about 3 to 4 weeks. However, if the baby is having a tough time latching on, the American Academy of Pediatrics actually recommends that you actually don't use the pacifiers until about 4 weeks, because the pacifiers could cause what's known as nipple confusion. A nipple confusion is when the baby actually prefers the pacifier against the real thing. So what are the pros of using a pacifier? The obvious pro is that it will soothe the baby, especially if the baby just fed and are quite full. You can't just keep on giving the milk. And the sucking itself soothes the baby, so it actually sometimes helps the baby to fall asleep easier as well. You could also use the pacifier as a distraction during difficult situations or uncomfortable scenarios, such as going to the doctor's office or getting the shots for your baby. Also, when you're using a pacifier, that you have control over when and how to use it. So when it comes to actually trying to wean them off the pacifiers, it will be easier to control, because it's a lot easier to take away the pacifier than stop them from sucking their thumbs or fingers. And lastly, a pacifier use could actually reduce the risk of SIDS, sudden infant death syndrome. If you want to find out more about it, here's a link to the video that I made. So if there are so many benefits, what would be the cons of using a pacifier? The number one con is that the baby may become dependent on it, and it could interfere with the breastfeeding, as I mentioned earlier before. And also, it could cause a middle ear infection. However, the babies are really looking for the pacifiers usually during the first 6 months, which is when the risk of SIDS is highest as well. The risk of middle ear infection only increases around after 6 months. So if you want, you can start weaning them off from about 6 months on as well. And another common concern between the parents about use of pacifiers is that it may cause some dental problems. Doctors say the normal use for pacifiers is not going to interfere with the dental health of the baby unless the usage is prolonged over a very long time, like 3-4 years. By that time, the baby should have came off the pacifier. So the cons start to outweigh the pros once the baby starts to get a little bit older. So when should you stop using the pacifiers? Well, for most babies, they will come off the pacifiers naturally by the time they're 2 to 4 years old. But certain babies have a tougher time coming off it, so you may need to help weaning them off. So what are the ways that you could help the baby come off the pacifier? The first way is to come off cold turkey. You are going to have to go through a lot of the tantrum and deal with the baby, and this is probably going to be much tougher for most parents. So it is not my first recommendation. The second method is to come off it a little bit slower in a way that you only use it at a certain time. For example, before they're going to sleep. So another way is to use it at a specific location, like a crib. Lastly, you could also provide an alternative object that the baby could use to soothe themselves. So that could be a favorite blanket or a favorite stuffed animal. Pacifiers is not for every baby. Some babies love it, some babies prefer their fingers and thumbs. However, whatever you decide, I hope the information that I shared with you today will help you along your journey. If you found any value in this video, please hit that like button and subscribe for more information in the future where I'll be sharing more tips and insights. Thank you very much, and I'll see you in the next video. Happy parenting!